Hi, this is Dr. Lauren Allison, and I am a doctor of Naprapathic Medicine, and I wanted to give you a brief explanation of what naprapathy is and what we treat and how we treat it and the general philosophy. So naprapathy is basically the treatment of connective tissues. Now, the treatment of connective tissues, that can be with regard to spinal alignment and joint alignment, which is also something that we're specialized in. But we're specialized in treating it through connective tissue. And so what are connective tissues? Meaning ligaments, tendon, and muscle, primarily. And so by treating those, because bones don't move on their own, they are twisted, pulled by the tissue that's connected to them. So in and of themselves, they do not move without being moved or pushed or out of alignment. So such as something like a car accident or some other type of trauma can force a bone out of place, but then the muscles associated with keeping it out of place are activated through that type of a trauma. So what we do is we go in and we try to treat the connective tissue that is holding the bone out of place or in a painful position, and we treat that tissue so that the bone either allows itself to move or we help it move into position. Now, naprapathy tends to be a very successful mode of treating this type of an issue. It's very durable and it's fairly quick, and meaning, you know, it's not something where you have to go 2 times a week, 3 times a week for several months, because if you're treating in that manner and it's not working, then that generally means that your approach is not successful and it needs to be modified. So in naprapathy, in general, our treatment protocols are much shorter. For, let's say, a person has low back pain or neck pain or pain in the middle of their back, just for starters. Some of these things can be treated with a lot of rapidity through different modalities or different types of therapies. But in naprapathy, generally, if you're not getting fairly quick results, and what I mean by that, depending on the condition, but in more simplistic conditions, you can get results very quickly with either in the same day treatment or within just a few treatments. And from the naprapathic standpoint or the point of view, if you're not getting improvement fairly quickly, then the method of treatment needs to change, and it needs to be changed quickly to adapt so that you find exactly the right treatment, and it's not just so we keep moving the same tissue around, moving it around in hopes that, after 12 treatments it's going to feel better. If it takes that long, then that is not the right treatment. So one of the other things the naprapath does is we do nutritional counseling, and what the nutritional counseling is for is to make sure that you have the relative balance of nutrients that allow the tissue to keep itself functioning in an optimal state, and that repairs are done fairly quickly because the body is fantastic at repairing itself when it's given the proper nutrition and the proper environment or the proper therapy. So that's the general synopsis of what a naprapath does. It's a manual type of medicine, so very similar to chiropractic and some therapies, tissue therapies, hands-on tissue therapies. It's just that our approach is a little different, and I'll explain that in another video. So thanks for watching. Hope this helps.